Hello, everyone. Welcome to Monday, nearly the end of July. It's July 27th. We are missing Colleen today, and hopefully she'll be able to join us shortly. Some technical challenges today, and so we'll get her on just as soon as we possibly can. In the meantime, we're going to go ahead and get started. First of all, it's good to be back, and hope you all had a wonderful last week. Grateful to be here with you today. I have, of course, our typical situation update, and then I'm going to call this Myth Busting Monday. I'm going to see if I can discuss some of the recent myths out there. And then I'll touch a little bit on the National Guard testing site and a couple other pieces here. So first of all, for La Crosse County, we have increased in cases from yesterday to today by 7 cases. And then I'll include our weekend numbers as well. So on Saturday, we had 10 cases, and on Sunday, we had 21, of which 11 of those were from the National Guard testing site on Friday. So we did expect to see a little bit of an uptick in our case numbers relating to having a testing site. And I see Colleen is coming on. Our total negative test results, so the total positives puts us at 749. And again, 7 new ones today so far. Negative test results for La Crosse County is at 16,046. Hospitalized or ever hospitalized is 6. Recovered is 628, which means we currently have 121 active cases, which is 16%. And we have had 1 death in La Crosse County. Wisconsin numbers, we are up to 49,417 total positive cases. That is an increase of 590 from yesterday. Our negative test results from yesterday went up by 6,356. Our hospitalized, ever hospitalized is 4,420, which increased by 26 from yesterday. Total deaths, 893, which increased by 1 from yesterday. In the state, the total number of recovered cases is 38,633, which is 78%. And their active cases are 9,873, which is 20%. So a little bit of positive news here, if you didn't catch this, is the 20% active cases at the state, and we have 16%. We're below the state for numbers of active cases. That's very, very exciting considering the surge we just came out of and how many cases we got fast and furious. And for a long time, we have been above the state percentage with regards to active cases. So that is good news. So then I want to talk a little bit about some myths that are out there. And the first one is with the compass changes that occurred last Wednesday when the compass updated. I had previously given a notice about the 2 changes in particular that were coming. And to just reiterate, those were specifically one of the public health related metrics moved to the healthcare side because it really is about the time it takes for the test to come into the electronic disease surveillance system, which is the way that public health gets notified. And really public health has no ability to adjust that. That is really in the healthcare realm. And so we moved that to the healthcare side. And the second change was relating to cases. Again, just looking at numbers of cases alone is not enough to identify and assess risk for our community. And the state has recently changed to going with both trajectory and burden, which are data related terms that basically say not just the number, but also the rate. So it's a number per 100,000 population. So we adjusted our metric number 3 to coincide with the state's metrics. So I think what happened is that individuals in our community who saw that we went from orange or high risk to severe or red felt that we had made changes to make that color indicator light changed to red. And very simply, that is just not true. We can and only will ever use data-based, evidence-based information for the compass. And that includes any changes that we make to the compass. We do not make changes lightly. They need to be evidence-based, they need to be fully vetted, and they come from a data aspect. I would actually say that if we took into account the potential perception that may come from making a data change, that would be inappropriate. Because when you look at data, it needs to be solid, it needs to be hard and fast, and it cannot take into account beliefs, politics, perceptions, or anything like that. The way that we can be the best service to our residents, both here and at the state level and across the state, is to make sure that those metrics are truly data-driven and are not pulling in other factors. So I just want to be very clear that the changing of the indicator light in no way, shape, or form had anything to do with any manipulation of data. That would be inappropriate, and it would also be inappropriate for us to make a change to do something in order to like reduce or change a perception that might happen. So those two things just cannot be connected, and I want to do my best to bust the myth that somehow was done on purpose. None of us, including myself, 100% want to be in red. We do not want to be in red. So we would never manipulate data, nor would we ever try to keep us in a higher risk category than we really are. The goal of the compass is and always has been to have data metrics that appropriately allow all of us to assess risk levels and to then utilize that as a tool to guide decision making at the individual, business, and community levels. And just a reminder that it is not just about case numbers. It is also about case rate. It is also about our ability to reach cases and contacts quickly. It is about our ability to have adequate testing to be able to identify the true level of burden of COVID in our communities. And it is also about our status in healthcare settings to assure that we can meet the needs of those that may require higher levels of care. And thankfully, we have been able to keep those fairly low. So we certainly hope that clears up any questions. But the compass is a solid tool, and there will never be any manipulation of data. Next, I think one of the questions that I'd like to talk about is, what can we do? So we're in red. We don't have case numbers as high as we've had them. We know that the risk level of severe or red is not just about case numbers alone. And I think the question of what can we do is really an important one. And I'm really grateful to whoever asked that. And I want to answer it. I want to answer it from both a health department perspective as well as an individual and community perspective. So first of all, from the health department standpoint, this is entirely what our response is about, is to assure that we are attacking COVID from every angle that we possibly can with every resource we have and can garner to make sure that we are keeping the burden as low as possible in our community. And some of the examples of our doing that includes bringing on more workforce to cover disease investigation and contact tracing. So initially, we had a 2% amount of positive cases or total out of our total testing. And very quickly that jumped to 8%, and that overwhelmed our resources, and we had to send cases and contacts to the state. And we've talked about that we really want to keep those cases and contacts in-house, predominantly because that really improves our ability to respond quickly to understand our own residents and how to serve them, especially if they have specific needs relating to being able to isolate or quarantine. And we have seen that it is more efficient for us to keep cases and contacts, and it will help us keep the metrics in check in the compass as well. So we did add a graph under the public health section of the COVID compass that talks about where our percentage of or our ability to reach cases in a timely fashion. And you'll notice that there is a grayed out area that identifies when we had to send our cases and contacts to the state. So I encourage you to look at that graph if you would like more information about it. But we are hiring a total of 24 FTEs of contact tracers and disease investigators to support the response. Part of this, and this is based upon a formula that the state came out with in conjunction with funding that the state provided to get at disease investigation and contact tracing. And we don't have 24 people that can do that work in our department. We only started with 55 total, and we have lots of aspects of response. So it is really important for us to get that workforce on board. I would say that we're about halfway there, and we've definitely increased our ability to get at cases and contacts more quickly. And that will just continue to improve, which I think is really important and is one of the ways that we provide the best service that we can to you as residents. Secondly, it's important because it is part of our metrics to have enough testing. And we have talked about that there just is not enough testing capacity with just healthcare systems alone in our community. And we have had to bring in testing sites through the National Guard. And because the National Guard was not going to be available to us after August 7th, we put 3 testing sites. We've had 2 of them, and we're waiting for final confirmation on the final one that we hope to be on August 3rd. We've had those in a short time span in order to increase testing capacity. That is not easy for us to do. That requires staff to coordinate that effort and put the testing site on. It requires us to get volunteers to work at the testing site. We do that because we believe that it's really important to our community to have enough testing access. And it also is one of the metrics is our ability to meet the testing goal. So that is another item that we think is really important and a way that we're trying to do what we can to try to reduce the burden of COVID in our community. There are a number of other things that we have worked on, and I'll just briefly mention these. First of all, as you know, we've been connecting with K-12 schools across the county for months and trying to assist them with their planning efforts for this fall. We are connected to higher institutions of higher learning or higher education, so our university systems and technical college, and trying to help them with their planning. We have provided business guidance and have started a business recognition program with Stop the Spread or Check the Spread. And we think that is really a positive experience for businesses, and it also supports them in getting at the most critical aspects to reduce burden of COVID in our community. And we are working with a group of 20 to 29-year-olds to try to get that age group to increase mask wearing, which is a strategy based upon what we learned from the last surge event. And also are working very closely with assisted living and long-term care facilities in a lot of ways, particularly because that is where the most vulnerable populations in our community are located and where we are most likely to have mortality or death from COVID. And those are congregate settings where spread could happen rapidly. Those are just some of the examples of the ways that we have divided out our response to try to serve you as best we can. I think here is the juncture where I would like to indicate, that this is a team effort. This is not just the health department that really raises up everyone and protects everyone. We cannot do that alone. We need you to help with that effort. And I want to call out that this is exhausting for all of us. This is hard work, not just in our day jobs, but in our beings, in our ability to connect with our families and our friends, you know. And when we are doing what's right, those connections are really difficult. We can't be in close contact with others. And I want to recognize that those of you who have been taking those actions, I know how fatiguing it is. I know how difficult it is. I do it every day. And it's really tough work. And so I just want to thank you for that tough effort that you're giving. And as long as you've been giving it, and I wish I didn't have to ask for it to continue, but because this is about a fight against a virus that doesn't care if we're tired, unfortunately, we have to continue those actions. So, you know, we have seen members of our community become infected with COVID and worse, have significant illness or die from COVID because of social gatherings and because of the connections that we have with others. So, for example, if we have a graduation party, or if we are celebrating a birthday, or if we are celebrating Grandparents' Day or Father's Day or Mother's Day, all of those are situations in which we may let our guard down and we may allow ourselves to be in close contact with others. And those are the ones in particular, those are family members and friends that we don't want to infect. No one does that on purpose. It is not something you realize that you're doing, most likely. Most people who feel sick will stay home. And this virus is very smart. And the symptoms that it has, it starts with no symptoms for most people, and then symptoms can be very mild. And we come from a culture that says, go to work, don't worry about mild symptoms. And we have to challenge that with COVID because this virus doesn't follow that same cultural line. And so I would just encourage you that what you can be doing right now is the same thing I've been asking all along. And it is wear a face covering or a mask when you're out of your house. Don't leave your house if you are feeling ill in any way. Be aware of the symptoms of COVID and that it can start without symptoms and it can be very mild. Wash your hands, don't touch your face, and always physical distance with anyone outside of your household. If we are not doing those actions, if every single one of us is not doing those actions, we can have impact on someone else and not even know it. I know that last week, if you tuned in to the media briefing on Wednesday, and if you didn't, it is available on our Facebook site. Jackie Cutts, our public health nursing manager, went through one individual. It started with one individual at a location in our community for a meal, and that resulted in I think 29 cases and 75 contacts impacting various aspects of our community, including assisted living and long-term care sites. And that is not something any single person would ever want to happen, but it happens with this virus. And I just remind us all that we are fighting against a virus, not each other. This isn't political. This isn't about what we believe. This is about what this virus is doing, what we know about this virus, what we don't know about this virus, and using the information that we have and using that to make good decisions, to protect ourselves, our family members, our friends, our loved ones. And any single choice to not do that can impact others in ways you may not even know. So those are my asks of you. In addition, I do just really want to thank that there are many businesses and community members that have been taking the guidance, using the guidance from the Compass in particular. It's been a very helpful tool. I'm just so grateful that it has been helpful. I think one of the challenges is that there is not, there is CDC guidance and there is Department of Health Services information, but everyone that we've encountered who is trying to create a plan is told to contact their local health department. We are a team of 55 individuals, of which At least 12 have to be continuing daily activities every day. The rest of us are in response in some percentage of our time, and that is not enough to support the needs for COVID. And we're doing everything we can across the strategy level, the primary, secondary, and tertiary prevention levels to decrease cases in the first place, spread, and decrease disease and impact of disease and death from COVID. And we need your help. We need you to be taking those actions and taking it seriously, because without that, we will really struggle to beat COVID. And just want to also plug here that I think flexibility is the word that we need to have with COVID. We have to be flexible to know that at any week, any Wednesday when we update the compass, that the indicator light could change. It could change in a way we don't expect, which is what happened last week. It could cause challenges with things we had planned to attend or we had planned to put on. It also means that we have to be flexible, knowing that we are continuously improving and learning about this virus. And we have to make sure that we are using every amount of information that we receive as soon as we receive it to update and improve our data sources as well as our responses. And that is our pledge to you, is that we are putting in every effort we can to be as on top of that as possible, so you always have the most up-to-date information to make good decisions. So that is what I'll say about the compass in particular and what we can do. I'll also say, and I've said this before as well, with masks, there are individuals who believe that the masks are not effective. I will just say, again, the virus is spread by droplets. Sometimes it can be through an aerosolizing activity like singing, coughing, sneezing, exercising, but most often it's by droplets. And as we talk or we cough or sneeze, those droplets can be caught by a fabric face covering or a mask or a surgical mask. We do not have access in general as a population to respirators, which is what an N95 is. Those are most appropriate for healthcare settings, but we do have readily accessible tools, including some kind of a face covering. And I think it is a really important tool, and it can prevent the spread of COVID, because we understand COVID spreads by droplets when you're talking, coughing, sneezing. If you have a covering, typically those droplets are large enough, they do not go through the fabric. Does it mean they're 100% effective? No, it doesn't. We've never said that, but they are an important tool to decrease the spread of COVID. And to look at a mask in any other way is not evidence-based. So I think it's really important for you to understand why we make that ask. We don't do it because we want to push people to wear masks. It's not comfortable for me. I'm sure it's not comfortable for you. However, it is an important tool to protect others. And I think it says to anyone around you when you're wearing a face covering that you care about them. This shouldn't be about something that's uncomfortable or embarrassing. This should be about fighting a virus and doing it together. And lastly, I want to touch a little bit about the death that we had recently, and specifically how deaths are reported in our county. I'm going to gather some additional information about this topic from our experts in the community. So I will tell you more about that as soon as I have more information. But there are multiple, sometimes there are primary and secondary causes of death. And I know there have been questions about if someone's in a car accident, for example, and they pass away and they are found to have had COVID, would that be listed as a primary cause of death? Not likely. The primary cause of death is going to be the car accident, unless there's some indication through the investigation process that that is different. But I will get more information on how cause of death is determined. especially as it relates to COVID. What I will tell you is that our recent death, I think one of the other pieces is that there was a notion that maybe that death was counted in 2 counties. I can assure you that that is not the case. We have a specific way that deaths are reported. They are reported by county of residence. So we cannot report on a death that occurs in our facility in La Crosse County if that resident lived in a different county. And that can be confusing. We can only report on deaths of La Crosse County residents. So I can assure you that that death that we just had was not reported twice. It was only reported in La Crosse County. I can also tell you that the individual that passed away did not have underlying health conditions, was not in a nursing home, and that was a close contact exposure, as COVID typically is. So I think that we need to be careful when we share things that may not be true. Please fact check, because it could be really hurtful to others when information is spread that is not accurate. And that's really what we're here for, is to try to make sure that we can help you have information that's accurate. And I recognize that no matter what I say, there may be individuals who don't trust county government, who don't know me, don't know my staff. All I can give you is basically my word to say that public health and the health department in La Crosse County matters greatly to me. And what we do needs to be right. It needs to be accurate. And we will be transparent with how that is for our community. And that's a pledge that I give to you. And I can't make you believe that. I can only indicate that that's what's true. So I do want to touch base also on the National Guard testing site, and that the overview from Friday's site, we had 251 total tested, 11 so far that are positive from that testing site. And we're still waiting for all tests to come in so that we have the data on these. So as soon as we have all the information, of course, we'll share that as well. And I think those are the pieces that I needed to specifically talk about. And now I'll take questions and provide answers. Did I put everybody to sleep? Oh, phew.
I was going to say, I think you just did a great job. That I don't think any of us have questions, but I have one last one here
Okay.
for you. In terms of the death, I guess, when can we expect to get more information on more of the details surrounding that? Do you know?
Justin, I think that to give more information besides what we have already provided is not appropriate in relation to being HIPAA compliant and being respectful to the family. If that was my family member or someone else's family member, what is shared about that should be only what is necessary and appropriate. And I think that we have already done that. So again, I'll just reiterate that that was a very sad situation. That individual did not have to die from COVID, and I feel for their family significantly. And I think that unfortunately that could happen to any of us if we let our guard down and we allow ourselves to be with others outside our household, because again, we can be spreading the virus and not know that we have it. And I really believe none of us would spread the virus on purpose. And that's the challenge with COVID, is that that can happen without us knowing it's happening. And the results of that can be devastating. And I'll leave it at that.
Hey, Jen, this is Dustin Lukey with WXOW. Could you talk a little bit more about the hiring, the full-time employees as contract tracers? You said you had about half hired. Are you still looking, and where can folks go? Like, what requirements are you looking for? Where can people go?
Oh yeah, good question. So way back at the end of May, some may have seen, well, I know we had folks in our community see it, but the state posted for contact tracers. Initially, the state was going to hire those positions, and we had over 100 applicants from La Crosse County residents for that position. And so that is the applicant pool that we've been using to look for disease investigators and contact tracers. And again, we're using a formula from the state that I have to be honest, I never thought we would have an 8% positive rate. And then when we had it, we're going to be better prepared for next time. Hopefully there isn't a next time. But we have hired, I think we're on our third batch, and we're hiring them in groups of about 10, because we need to make sure that we can adequately train them and get them off and running, and have enough staff capacity and bandwidth to do that successfully. So we're doing it in small batches. So we have about 15 left to hire, and none of them are full-time. We had hoped that that could be the case, but just the hiring process is such that they need to be part-time and would be hired as limited term employees with our department. And then we provide the equipment that they need and the training that they need to be able to do contact tracing. And some of that training includes listening to a contact tracer make calls, taking a course that we have that's really, really good, learning about our electronic disease surveillance system so that they understand how to find the information they need, how to enter the information they need to enter. And also then having someone listen in while they make some of their first calls. There can be quite a bit of variation in calls that we make for disease investigation and contact tracing. Everyone's situation is slightly different. And so we try to talk through some of those scenarios to make sure they're adequately prepared. And I have to tell you, we have some really good folks on board. And we've been able to already transition a couple of those from where they're initially hired for contact tracing, because our team, who was the most experienced, we kept in the disease investigation roles. And now some of those contact tracers are so skilled that they were moving them into disease investigator roles. And so we continuously look for those in the contact tracing positions that are really good at it and interested in becoming a disease investigator. And then we train them in that role as well. And all of that is helping to increase our capacity to be able to quickly get at cases and contacts in a way that is better than it's been in the past. And we also have added some other tools that I think I've talked about before with HIPAA compliant JOT forms that allow us to quickly get information from a case or contact if we can't immediately reach them. And some of that is being done when they're notifying, when health systems are notifying individuals that they are positive, they're going through that with them right away. So we already have that information when we go to make the call, which can help make that process faster, smoother, and better for the individual on the other end of the line. So it's been very successful.
Hey, Jen, it's Rick at WIZM. First, the total hospitalizations, I know last week is at 33. It's not a metric you're putting on the Facebook page, and maybe you said it. Excuse me, I have a little COVID. No, I'm just kidding. And then lastly, what's the longest turnaround for either the National Guard testing site or just the getting tested in town? If the turnaround is like 4 or 5 days before you're getting results, obviously those people have to quarantine for 4 to 5 days before they know what's happening. And sometimes I feel like that's not always realistic, even though if they do have the virus, then they do have to quarantine. But I mean, it's got to be disheartening to not have the virus and then not know for 5 days and be like, oh, I could have been at work or whatever.
Absolutely. Yeah. So those are two great questions. First of all, thank you for the total hospitalized 33. I asked my team that this morning. I wasn't here last week. I was on vacation. So what I reported with 6 is the current hospitalized. So thank you. My understanding from my team is that they will be reporting that total ever hospitalized on a weekly basis. That was something that was asked about before I left for vacation, and we discussed, and then I was gone. So I didn't get the update on how that was going to work, other than they are going to report that weekly. and the current hospitalized is 6. So thank you. The National Guard site turnaround time, I think that varies by the date and time that a National Guard testing site is happening. For example, the ones that we had in May had a turnaround time quite a bit longer than I think what we're seeing right now. And so I think that it does vary. Currently, I know that obviously 11 individuals we already know from Friday's site have come back positive. So I don't have an exact date range for this current testing site, nor, because I was on vacation last week, do I have an update on the community testing in general, how long that is taking. I know that before I was on vacation, it was not where we wanted it to be. And we continuously are working on that. I know some things changed with capacity for testing. Might even have been later last week. I saw something about that. So I can look into that further, Rick, and hopefully address that question in more detail on Wednesday. But I agree. I'll just say the testing time taking 4 to 5 days is not where any of us want to see that. We want to see it as quick as possible because it's difficult if you have to be in quarantine waiting for your test results. And I think that can increase the inability for us to have compliance with individuals actually staying home because it can take so long. And we absolutely need to improve that. It's certainly very important to us.
Jen, we are getting a lot of Facebook questions about schools and if you could address schools opening.
Yeah, so a lot has been going on with schools. I'll do my best. If I don't specifically address the question you have about schools, please let me know. I think that, so again, I was on vacation last week. What I'm aware of is that we are going to be, a couple of weeks back, we had made a change to the K through 12 schools line with regards to being in severe or red, severe risk category. And I will just say, we don't think that that was the right move. And we're going to readjust that back to being that we should not have face-to-face in severe risk level of the compass. I think what's really important is that if our goal is to provide a safe learning environment for our kids, I have kids in elementary, and now both my older ones will be in high school. I'm on a school board. We're addressing these same questions for where my kids go to school. We've been connecting with schools. One of my staff members, Carol, has been the primary liaison with school districts for months. Schools have a big lift to make to be able to provide a safe learning environment. And prior to my leaving on vacation, I was in the meeting with the schools that Thursday, and I'm really pleased with our schools. They're just working together, and we have such an important, strong partnership. And we listen. We heard from teachers, and we heard from individuals, and we listen, but we need to make decisions based upon data. And I think that if our goal is to provide a safe learning environment for our kids, and if safe is defined as a low risk of exposure to COVID, that in severe risk category, that is not possible. And I have struggled with that. And I shared that with the school district administrators and those that are on that work group before I left for vacation. Now, that said, we do intend to make a change to the compass in regards to the K through 12 school districts. There's also some discussions about individuals, young people who might be in environments where they really need certain school services, even if school is not face-to-face, in person at the building. So we're looking to figure out how to best address that and whether or not that belongs on the compass recommendation grid, and also how to address extracurricular activities and sports and maybe even music, because those can be, again, physical exertion and singing. It can be aerosolizing activities, which means that a 6-foot distance may not be enough to fully protect individuals. And so part of the challenge with this is the evidence is not exhaustive. There is not a ton of literature around this because we haven't had kids in school with the pandemic for the most part, because we were in safer at home order and school was out of session. So to be really intentional and planful for this coming fall is something that is a big lift that takes a partnership and a lot of input and data searching to really get it right. And we're doing the very best we can, meaning schools and our department, to do that, knowing we're also on a timetable to be able to have those plans be distributed to families so they understand what's happening. So I don't know if that specifically addresses the question, but we do anticipate seeing a change to the compass with regards to schools, because the change that we previously made where we took away we said it might be okay in certain situations to have in-person in severe risk. We do not believe that that was the right move to make. And we are not so prideful that we will not take back something that we think wasn't right. So we are going to adjust that. And I do not believe that severe risk should be in-person school. I think it's too much of a risk to put our staff and students in. I don't think it's a realistic lift that we can make, no matter how much planning we do. And I'll just repeat what I think I said before I left on vacation, which is individuals that are doing all of this planning. When a school closes for a day of severe weather, it's one flip of a switch. To prepare for COVID in this current environment is like 254 switches that we have to try to make sure happen every single day. And at some point, which is in the severe risk category in particular, it is just not the safe learning environment that is appropriate to put our staff and students in.
I'm not seeing any other questions for you, Jen.
Okay, well, before I sign off, I'm going to start something new. I think that in the time of COVID, it is really tough to be hopeful and positive. And if I've struggled with that, and I'm a pretty positive person, I can only imagine that you all have struggled with that. So before I sign off each day or each media briefing like this, I am going to give some kind of a message. And today, I want that message to be that we as a single individual, we might be one person, but one person can be mighty. And my quote for the day comes from Tim Cook, and it is, "You want to be the pebble in the pond that creates the ripple for change." So just in the same way that we can create a ripple by not doing the right things and causing a negative result that we may not even know about, we can also be the ripple that causes positive change that we don't even know about. And again, I reiterate the simple asks of wearing a face covering when you're out of your house, staying home if you're sick, washing your hands, and physical distancing at least 6 feet when you're around others. Follow the Cooley Compass, where we want to provide you with the tools to protect yourself, your family, your friends, your loved ones. So be that small pebble that can make a positive ripple in the pond. And then I'll end with a little gratitude piece. And this is a little odd, but I could be a little odd at times. And I have a gratitude app, and it said, so look in your kitchen. I said it was odd. Look in your kitchen, and what are you grateful for in your kitchen? Are you grateful that you have a microwave? Are you grateful that you have maybe a water dispenser in your fridge? Are you grateful you have a kitchen? Some people don't have a kitchen. So I think if we look around our environment and look for those small things that we take for granted, it is one way to see hope and positivity in a time that can be very difficult. So I'll leave you with that. We'll see you Wednesday.